Hey, it's Mo Egger. It's football season, and there's no better place to post up to watch the games than Long Neck Sports Grill. Start with the TV setup. There's 4K TVs all over the place, and the sound is on for all the big games. Then there's the menu. It is awesome, and it's extensive. I love the wings, and of course, you need beer. No place has a better beer selection than Long Neck's. 3 Northern Kentucky locations, Wilder, Hebron, and Richwood. Long Neck Sports Grill. Stay late. Come often. It's time to talk injuries with Dr. Shankar Narayanan from OrthoCincy. OrthoCincy.com is the website. There's locations all throughout greater Cincinnati, in the Cincinnati area. That includes, obviously, Northern Kentucky, Southeast Indiana. With OrthoCincy, you never need an appointment. Plus, they've got locations with evening hours and Saturday hours. Find the closest location to you at OrthoCincy.com. You can make an appointment, but you don't need one. Again, OrthoCincy.com. Dr. Narayanan, let's start with Logan Wilson. Shoulder injury kept him out of the end of the game on Sunday. It's the same shoulder he had labrum surgery on, missed 4 games last year. Not a lot of specifics in regard to his injury right now, but run the gamut for me. What are the possibilities with Logan?
Yeah, so Logan Wilson, just like some other guys that you've probably heard of, like Baker Mayfield last year, suffered a shoulder dislocation. And a shoulder dislocation is when the shoulder actually comes out of the socket. This is the most common joint to come out of the socket, and it happens in young athletes, and very frequently can happen in men and in women too. The shoulder will come out, generally speaking, in the front, and it needs to sometimes be put back in. And the labrum acts as a bumper to keep the shoulder within the socket. When the shoulder comes out of place, the labrum tears, and the shoulder has more of a propensity to come out of place. And that's why Logan Wilson underwent arthroscopic labral surgery last year in order to repair that. Now, again, I don't know exactly what happened to him in New Orleans this past weekend, but it's safe to say that something may have happened with his shoulder. He may have had what we call a subluxation event, where the shoulder tries to come out of place but doesn't fully come out of place. Or he may have had a frank dislocation. We don't know. I highly doubt that. But whenever you have a patient that has shoulder instability, there are multiple things that you worry about, and especially someone with recurrent shoulder instability. So the hope is that Logan Wilson could potentially put on a brace or a harness and play with this, and it can be addressed in the off season again if needed. But in the event Logan Wilson needs something more, it could involve surgery that would basically involve the bone of the actual shoulder, the glenoid, where we would have to potentially reconstruct that bone if needed.
When you're dealing with an injury to a shoulder that has already been operated on, I guess, and maybe this is a dumb question, what's the concern about him dealing with something that becomes chronic?
Yeah, there's definitely concern about that. And when someone has that shoulder instability, a one-time event's very different than a multiple-time event. And if he actually has the shoulder coming out of the socket, so to speak, frequently, then it's termed chronic shoulder instability. And in order to play contact sports, he would likely need something done in order for him to get back on the field.
Let's talk about Jeff Gunter, who suffered a knee dislocation during pregame warmups. Now, a knee dislocation to me sounds like something that you might suffer while engaging in full contact, not warmups. So how does something like that happen?
Yeah, let's talk about that real quick. So there's a perception that Jeff Gunter and Jonah Williams suffered what we call a knee dislocation. And really, a knee dislocation is a devastating injury. That's when, if you remember, I think it was Mackenzie Milton from UCF and the guy Zach Miller, I think from the Chicago Bears, suffered true knee dislocations. And they had vascular injuries and nerve injuries to the point where I believe Zach Miller had to go to the operating room, had to have major operations in order to reconstruct his knee, because when you have a knee dislocation, you actually tear the ligaments inside your knee and you can have neurovascular injuries. I believe, and again, I don't know, but I believe Jeff Gunter suffered what we call a kneecap dislocation or a patella dislocation. The kneecap is the bone right over the knee that we all feel when we kneel down. And occasionally speaking, it can subluxate or frankly dislocate, and people feel like the kneecap goes behind the knee. Sometimes some people need to go to an emergency room, or they can have it reduced on the sideline. But a one-time issue for a kneecap dislocation, usually not a huge deal. Patrick Mahomes suffered this when he, I believe, was doing a quarterback sneak a couple of years ago, and he was able to play the next week. You were able to put a brace, specifically like a J brace, in to inhibit the kneecap from dislocating laterally, and you should be able to play as long as advanced imaging in the name of an MRI doesn't show any cartilage injury or any osteochondral or bone and cartilage injury to the kneecap. Now, if Jeff Gunter or Jonah Williams had that, then we would be talking about something different, and they would likely have to have something more advanced in order to deal with this.
Let's talk about something kind of broad involving Josh Tpou, who left the game on Sunday with a calf injury. Give me an idea of what some common calf injuries are and what's the range of severity.
Yeah, so calf injuries are very tough, and they're a little nonspecific. It can be anything from a sprain to a strain, which is different. A strain is just the muscle kind of stretching, and a sprain is actually a mild tear within the muscle or within the tendon or within the ligaments. And it can also be anything into the Achilles tendon, like we've seen with Kevin Durant. Kevin Durant had questionable calf strain, and then he came back and suffered an Achilles tendon injury. So things like that can happen. Generally, you have a strain, which is really just kind of a rest, ice, elevation, take some nonsteroidal anti-inflammatory medication, to where you can have a sprain all the way up to a grade 3 sprain where you have a tearing of something. Now, I believe Josh Tpou probably doesn't have a significant tear within his calf, but it is entirely possible. Usually the team would probably get some sort of an advanced image like an MRI to determine the severity of this. But usually it's an overuse injury or an injury that can be caused sometimes by not stretching as much as they should or just tweaking it inappropriately. We're hoping that he could come back within the next week or two, get out there on the field and run with the guys.
Awesome stuff. This was terrific. I appreciate it, man. Thanks so much.
Yeah, thanks a lot.
Dr. Shankar Narayanan, OrthoCincy.com is the website again. You never need an appointment. Go to OrthoCincy.com, find a location closest to you, and they've got locations for your convenience that are open late and on Saturdays. OrthoCincy.com. Hey, it's Mo Egger. It's football season, and there's no better place to post up to watch the games than Long Neck Sports Grill. Start with the TV setup. There's 4K TVs all over the place, and the sound is on for all the big games. Then there's the menu. It is awesome, and it's extensive. I love the wings, and of course, you need beer. No place has a better beer selection than Long Neck's. 3 Northern Kentucky locations, Wilder, Hebron, and Richwood. Long Neck Sports Grill. Stay late. Come often.